of healthcare workers, patients, and their caregivers. To speak on the topic today, we have a renowned gastroenterologist, Dr. A.K. Kaushik from Chennai. He needs no introduction, however, I would feel my duty if I don't mention that he is a leading gastroenterologist providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has over a decade of experience building a clinical skill set that allows him to deliver patient-centric care. He is currently a consultant gastroenterologist and associate professor at SRMC Chennai. We salute his dedication towards spreading awareness related to liver health and disease. So without taking further time, now I invite Dr. Kaushik, sir, A.K. Kaushik, to enlighten us on the topic. Over to you, sir.
Hello, hi. Today I will be discussing about fatty liver, which is a very important disease and which is very common. And to just move the slides now. Yeah, as we know, the liver is one of the largest organ. It is present in the right upper quadrant of the abdomen, and it's basically a soft in consistency, and it is highly vascular, and it weighs around 1,500 grams, and out of its weight, 5% is fat. So what is the main functions of the liver? If you look into it, the liver helps in production of bile. It helps in regulation of blood composition. It helps in processing few nutrients. It destroys the red blood cells. It detoxifies the blood. It helps in breakdown of alcohol and certain medications, and it helps in production of protein and cholesterol. So what is this? Basically, when there is a fatty liver, the liver where the 5% of the fat, it increases and there's a lot of fat deposition in the liver occurs. And what happens is this will lead into inflammation, and this causes the whole spectrum of NAFLD and NASH. And this disease is not caused by alcohol or any other reason. The main etiology for the disease is the fat. And if the NAFLD is untreated, it leads into NASH. And the risk factors will be when the patient is overweight, that is obesity, having diabetes, high cholesterol are associated with high risk of developing this non-alcoholic fatty liver disease, which is called as NAFLD. So the prevalence of NAFLD is actually very high. 1 out of the 4 people will have NAFLD irrespective of the weight. And in patients with diabetes and overweight, the incidence increases. That is 6 out of 10 diabetes are having NAFLD, and 9 out of 10 obese patients are having NAFLD. And also there has been association that male genders have a high risk of developing a severe form of NAFLD, that is NASH. So this slide clearly shows this is the first one is a healthy liver. When there is a lot of fat deposition, it leads into fatty liver. And a fatty liver, which in turn, the fat will lead into inflammation, which will lead into fibrosis, which is the next stage. Until this fibrosis stage, it can be reversed. If the fibrosis stage is not reversed and the further damage of the liver occurs, then it leads to a condition called cirrhosis, where the liver is completely destroyed and the patient develops a lot of complications because of liver cell failure. So what is the difference between the NAFLD and NASH? Just with the simple fat deposition occurs on the liver, but there is no alteration in the liver function test, then it is called NAFLD. When there is severe inflammation and there is a damage of a hepatocyte and there is some fibrosis happening and some scarring happening, then it is called NASH. So what causes this NAFLD bar NASH? The main cause is obesity or the metabolic syndrome, and there is a genetic predisposition and a junk food intake, and there is a decreased physical inactivity, and exposing to certain medications, these puts the patient in high risk for developing NASH or NAFLD. So when the person is overweight and is sedentary, that leads to a lot of fat accumulation in the liver, and the fat increases to 5 to 10% of the liver fat, which leading into the NASH, and which is not controlled. And when adequate lifestyle modification and we don't do it, it leads into scarring of the liver, and eventually it leads into cirrhosis. So, what is the relation between the diabetes and this? See, when a patient with a fatty liver disease is more prone for diabetes, and the patients with diabetes are again more prone for NAFL. It is just like a vicious cycle. And the prevalence of this disease, as I already told in the previous slide, the diabetic patients have more prevalence of developing NAFL. And also, there is high risk of developing into cirrhosis. So what are the basically symptoms of NAFLD and NASH? See, NAFLD is just a fatty liver disease. So the patients will be totally asymptomatic. It has to be usually picked up in a routine health checkup or a routine ultrasound, where you can see there's a fatty liver, and usually asymptomatic. When we come to NASH also, the patients can be asymptomatic, or when the stage increases from the fibrotic to cirrhosis, the patient will develop all the symptoms of liver failure. That is, a patient will have extreme fatigue, distension of abdomen, that is because of accumulation of the fluid, and then there can be easy bruising and bleeding, pedal edema. Patient will develop yellow color eyes and urine, and then patient can also have blood vomiting. So how do you basically diagnose this fatty liver disease, or how do you diagnose NASH? Is basically by doing blood work, where you do a liver function test and look how it is, and by doing an ultrasound to know whether the patient is having a fatty liver or not. And then you can do a fibroscan to assess the severity and the scoring. And liver biopsy is not done these days for diagnosing of fatty liver. And you can go for an higher imaging like a CT and MR to have a proper diagnosis. So what is a common blood test? As I told you, we have to just get a liver function test, and where you have to look for any transaminitis, that is SGOT and SGPT, which is there in the liver test, see whether it's elevated or not. And also you can look for any other abnormalities of liver failure like albumin and other things. So, and also we can do a scoring system. There are different scoring system. Before only ALT, AST ratio was alone done. Now there is FIB4 scoring system and NAFL fibrosis scoring system. Again, this is with a basic blood test, and you have to just calculate the score. It tells whether the patient is having NAFLD or not. And also the patients themselves, they can do it by an online software where they have to enter a certain labs, and it gives a score, and it also gives who is under high risk of developing NASH. As I told you, the investigations will be a basic ultrasound, where you just get a non-invasive test and you get an ultrasound. You will know the amount of fat deposition, and it is easily available, and it's economic also. And but only disadvantage of the ultrasound is only if there's greater than 25% of the liver fat accumulation is there, then only it picks up. And it cannot differentiate fat from fibrosis. That is one biggest disadvantage with ultrasound. And next is something called transient elastography, which is commonly called as fibroscan. This is actually a very good, and again, it's a non-invasive test, where it can differentiate the fibrosis and the fat content, and it's easy to operate. And so only problem with this fibroscan is it's very difficult in interpretation in patients with obesity. So, yeah, as I was discussing, transient elastography is very good, and the basically it calculates the two things called LSM and CAP score, that is liver stiffness measure and control attenuated parameters, where we can clearly know the amount of fibrosis and amount of the steatosis in the liver. So another test is an MR. This can actually very good to detect the fat content. It's actually a gold standard. Just less than 1% of fat deposition in the liver can be predicted by using an MR. But the only problem, it's very expensive and it is not widely available, and it is a little time-taking procedure. So as I told you, there is no liver biopsy is done these days for just diagnosing of fatty liver. So, but if you want to prove it as a gold standard, then you have to just take a tissue from the liver and do a pathological examination to prove it. But these days it is not done because of the fibrosis scoring systems have done, and the FibroScan have changed the diagnostic method. And why it is not done is because it is an invasive procedure and it is painful, and there's also a chance of misdiagnosis in that is early stage. So how basically this slide, if you look into, when there is a deposition of fat in the liver for the patients, it can prognose it to isolated fatty liver, or it can lead to something called NASH. The patient can just stay with the fatty liver, or when the patient progress to NASH, then this NASH progress into fibrosis and it progress into cirrhosis. Once the patient develop this end-stage liver disease, and again they are more prone for developing something called HCC, that is hepatocellular carcinoma. When long-standing NASH over years of 6 to 6.5 years, there are high chances of developing into hepatocellular carcinoma, and also they can undergo decompensation. That is in terms of having a blood vomiting or a distension of abdomen, that is fluid in abdomen, and severe jaundice, and all this are high risk of this disease. So always, prevention is better than cure. So you should always act before there's a development of a complication, and you should identify the disease early, and you should take all the steps to reverse it rather than progressing the disease into a severe stage. And also there is association that patients with NASH have increased risk of developing heart-related disease. And also we should reverse it at the early stage before it develops a complication, because once the complication develops, and then the NASH becomes irreversible. So the best treatment for this is lifestyle. Good eating habits, that is taking a lot of vegetables and fruits, and that which helps in a lot of micronutrients, and brisk exercise, and to stop all the addictions like smoking and alcohol. And if there's any medications which triggers NASH, it has to be discussed with the doctor, and any possibility of changing the treatment options should be considered. So the weight management is very, very important in the treatment of NAFLD. So how to do is a combination of hypocaloric diet and moderate intensity exercises will help in losing the weight. And by losing 3 to 5% of the body weight improves steatosis. By losing 7 to 10% of body weight will help in reversal of NASH. That is, even though if the patient develop fibrosis, by losing 10% of the weight, it can be reversed. And this pyramid shows the benefits of losing weight. When you lose around 3%, there is reversal of steatosis. Around 5%, there is reversal of inflammation. When you lose around 7%, there is resolution of NASH. And if you lose more than 10%, there's resolution of fibrosis. So ideally, when someone has a NAFLD or NASH, the ideal weight reduction will be 10% of the total weight, with healthy eating habits and cut down on the addictions will help in reversing the disease. So what kind of diet to be taken is basically a food rich with vegetables, fruits, whole wheat, grains, olive oil, and a lot of legumes, a lot of herbs and spices are very good, which has to be taken in a daily basis. Fish and seafood can be taken like twice a week, and moderate portions of poultry, egg, cheese, and yogurt can be taken. And red meat should be, and high sugar like sweets and all should be restricted. Only very rarely it has to be taken. So as I told you, like doing an exercise is very important and losing weight. So exercise can be done both aerobic exercises and resistance training. When you do aerobic exercise, there's also increase in the cardiovascular improvement is there, and also weight reduction. When you do resistant exercise, it reduces the inflammation and improves the glucose absorption. And by doing both, the fatty liver will become normal liver eventually. So what all the tips you should follow is, the thing is, do exercise daily, get some good sleep, take proper vitamins and minerals through diet, do a regular health checkup, and eat small frequent meals, and the sugar intake should be restricted. So when it comes to treatment, there's a lot of drugs which can be used from pioglitazones to vitamin E. So each has its own advantages and disadvantages. And the pioglitazone can be used, and it has been proven to be safe in patients even with the diabetes. And saraglitazole is the other drug which is also used extensively in treating fatty liver disease and NASH. The duration of the treatment is for 1 year, and it can be used again both in diabetic and non-diabetic patients. Whereas vitamin E, it is a very good antioxidant, but the only disadvantage is we are not supposed to be used in patients with diabetes, and the duration of this is 2 years. So how to prevent fatty liver disease is basically you have to watch what you are eating. You have to limit the intake of saturated fat and trans fat, and cut down on addictions like quitting alcohol, quitting smoking. And one should plan to do exercise daily with a lot of dedication, and eating a balanced diet, limit consumption of refined carbohydrates, and limit alcohol intake. Take medications as prescribed, and maintain a healthy weight. And if there is overweight, a reduction of weight by 10% will significantly help in reversing the disease. Yeah, thank you. This is all about basic information of NASH, and just be aware of the disease by doing a regular health checkup. And if there is a fatty liver or NASH, taking a proper medical advice and following will help in reversing the disease. Thank you.
Thank you, sir, for this wonderful talk. I think this has enlightened all of us, and mostly all questions must have been answered. If there are some questions which I will have for you, sir. Sir, is fatty liver or NASH hereditary?
See, there is no proven thing, but there's definitely a genetic predisposition is there. So, and as obesity also runs in families, so fatty liver can also run in families.
Right, sir. Sir, I'm not obese, but my parents are having fatty liver. So, will I be at the risk of developing fatty liver?
Yeah, there is definitely a risk of developing a fatty liver. So patients with genetic history should have more frequent screening, and to look if there is any fat deposition in the liver. And also the diabetes also is very important, on also checking on whether the parents are diabetic and other things, even checking for the blood sugars and cholesterol. Basically, a regular health checkup will solve all the problems.
What are your suggestions for lean NASH patients related to weight loss?
See, the thing is, lean NASH is coming up, but the only thing is, only the body weight is not the trigger. The inflammation can be precipitated by so many other things. Being thin but taking a lot of alcohol and smoking and not taking a balanced diet will definitely lead into liver inflammation. And cholesterol also will increase. So it's not only the weight, it's about all the factors should be considered, and stress and all these things need to be worked on. It's not about the weight because already they are lean. So the other hits, like other the triggers should be addressed. The proper balanced diet, which they must be missing on. So that should be emphasized to take a balanced diet, or they must be having a lot of stress. So that should be controlled, and yeah.
Sir, this fatty liver is also a lifestyle disease like diabetes and other diseases.
Mm-hmm.
So, how long the medicines of fatty liver will continue? Just like diabetes, it will continue for lifelong.
No, not required. See, when a patient with NAFLD or NASH, if it is not going to cirrhosis, if it is at the stage of fibrosis, it can be completely reversed back to normal. So once the liver becomes normal, and there's no point in taking medications. So adequate control of diabetes, making a HbA1c around 6.5, regular exercise and a proper diet, and regular follow-up through a LFT and ultrasound, then if everything is normal, under control, then there's no need for taking treatment. So it all depends on how you handle the disease.
Right, sir. So on behalf of NASH 24/7, I thank Dr. Kaushik sir for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is also important for people affected by fatty liver to regularly visit the doctor and continue medications if required. Because with careful observation and precautions, it is possible to obtain control of the disease and it can be reversible too. I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Once again, thank you, sir, and thanks all of you.